Bismillahirrahmanirrahim. Topic is the sonography of cystic liver diseases. As we discussed that there are three types of abnormalities which are commonly seen, or we can call them three groups. One is the diffuse liver diseases. The second one is focal liver diseases, and focal liver diseases is further divided into cystic liver diseases and solid liver diseases. So let's discuss the sonography of cystic liver masses. Cystic liver masses can be benign or malignant. If you look at benign cystic liver lesions, that can be cysts, hematomas, abscess, myeloma or seroma, biliary cyst adenomas, vascular like aneurysms or fistulas. A cyst means a simple cyst which is rounded, thin-walled, anechoic interior, posterior enhancement, and edge shadowing. These are 5 sonographic diagnostic criteria. Then is hematoma, due to bleed if there is accumulation of blood. The appearance of hematoma depends upon the age of hematoma from the time of bleed. Then is abscess. The abscess can be pyogenic or amoebic or hydrated cyst. Myeloma, in which there is a cystic lesion having bile in it, which is the accumulation of bile. Then is seroma, in which we can have some blood. Then is the biliary cyst adenoma, a lesion which is originating from biliary system and is cystic in appearance, having solid nodule. Congenital hepatic cysts are also seen commonly in some of the individuals. It is 2 to 5% of population which will have congenital cyst in the liver. It is usually simple cyst, as you can see on this rounded area. This is anechoic, black, smooth, thin walls, well-defined, sharp back wall, acoustic enhancement. This is edge shadowing. So it is rounded, thin-walled, anechoic interior. Then is the posterior enhancement and edge shadowing. These are 5 diagnostic criteria to diagnose or to label a lesion as a cyst. It is a simple cyst. Some of the cysts can have partial septations, which are common, and lobulated borders are also common. There is another cyst near to the capsule of the liver. You can see the thin wall. We are not getting the edge shadowing because it is not at right angle. So if we move the transducer at 90 degrees to this lesion, it will give that specific 5 criteria. So if you have a suspicion that there is a cyst, try to bring it at the center of your transducer so that the focal areas are appropriate. Here is a cyst, and you can see the enhancement and edge shadowing on both sides, thin wall, and near to that cyst is a portal vein, small portal vein, having its wall which is hyperechoic. We discussed before that it will be due to connective tissues, nerve endings, etc. Hepatic cysts, primary cysts are congenital, secondary cysts are acquired. As we discussed, the primary cysts which are congenital are 2 to 5% in population, their incidence, and secondary cysts are acquired due to trauma like myeloma, seromas, and hematomas, having serum or blood or bile inside. Secondary cysts can be infectious due to infection like pyogenic or parasitic. There are few complications of the hepatic cyst like hemorrhage, infection, and recurrence. Here is a cyst with fluid level. So this type of fluid level will be seen when there is debris or the debris is blood, which can be seen in hemorrhagic cysts. If it is pyogenic debris, by moving your transducer, trying to shake the lesion along with your transducer, but shaking means moving it gently, not trying to rupture the cyst by the pressure of the transducer. So if it is pyogenic, this debris will try to mix up with the liquid contents, whereas that mixing will be rare if there is a clot, if there is level of solid particles of blood in the hemorrhagic cyst. This is another large cyst covering almost whole of the liver. You can have multiple hepatic cysts, which can be autosomal dominant polycystic kidney disease. So whenever there is ADPK, which is the autosomal dominant polycystic kidney disease, we can have multiple cysts in liver also. There is another condition which is called von Hippel-Lindau syndrome, in which we get multiple cysts in the liver. Here is a kidney having multiple cysts, and in this panoramic view, panoramic image, we can see the liver starting from here. All of this is liver. We are having multiple cysts, and there is a dominant large cyst in the liver. So these are congenital multiple cysts, which are in kidney as well as liver. Liver hematoma can be spontaneous, post-traumatic, or post-biopsy. This is one of the hematomas. As I mentioned, it depends upon the age of the hematoma also. In the beginning, the solid contents will be more, and then there will be autolysis of proteins, which will increase the liquid contents within the hematoma. This is another hematoma in which fluid level is seen, and a thrombus is also formed, or we can see a clot is there, which will again liquefy due to autolysis within next 1 to 2 days. So if we scan this patient after 2 days, we will not find this area, and this will be increased.